just did with IV. So you could end up with trach suction, or you could end up with trach care. So I'm going to do the suction one first, because in real life you would suction the trach before you cleaned it, but I'm going to do them as two separate. Suction, you want the patient to sit up, if they can. Obviously, conscious patient, you want them sitting up. Unconscious trach patient, you want to lay them on their side. But I'm not going to sit him up too far, because with the mannequins, you have to be able to kind of get into where you're going. So, initial assessment. Go into the patient's room, listen to lung sounds. So you're going to want to bring your stethoscopes, listen, anterior, lateral, and then you can verbalize listening to the posterior, so that you don't have to roll the mannequin or sit them up or things like that. Now, in real life, you go in the patient's room, they're gagging on something, you can tell they're short of breath, they're turning blue. Don't stop and wait to listen to lung sounds. There's an obvious problem, suction them. But for your CPE, we're going to kind of do a controlled environment, and you're going to go ahead and assess. That way you know when you listen to lung sounds again, was your suctioning successful? Down. I'm going to turn my oxygen up. Now these don't really go up and down, but I'm going to turn it all the way up and let the patient breathe a high level of oxygen while I'm getting ready to suction. Because when I turn on the suction and I suction, I'm sucking all the air out of their lungs. The other thing I'm going to do is I'm going to put pulse ox on so that I can constantly assess the patient's oxygen saturation, so that I know in between suctions when he has recovered. Suction equipment. I'm going to turn it on to regular. Put my finger over the end. I'm looking for 80 to 120, which is this yellow area. Again, just turn it and say that, because these don't really suction. Okay? You want to keep your suction tubing close, because this is one of those weird sterile procedures, kind of like when you guys did Foley's, where you set everything up sterile and then you contaminate one hand. So you don't want to have to be reaching for a bunch of things away from your sterile field. So he's breathing his oxygen. I've got my suction set up. He's got his pulse ox on. So now your trach suction kit should have everything you need in it except for saline. Now, depending on what your facility stocks, they may stock the little square box ones that have a little thing of saline already in them. But what you have to think about is, this is not sterile. What's in here is. So it's kind of a process of setting things up of what's sterile, what's not. So I'm going to open my kit. Comes in a little package just like your sterile gloves normally would. Under one flap is a little cardboard box with a little plastic lining. It's set bottom out. What you're going to put on the table is facing you so that you can grab it. If you push at the corners till it locks on the bottom. Now, the inside is sterile. All I'm going to do, brand new bottle of saline, not expired, never been opened, so I'm going to open it. And as you fill it, that plastic lining will kind of sink down in there. Now, if all I was doing was suctioning, date, time, and initial of the bottle of saline. This is good for 24 hours. We'll leave it usually sitting on the patient's bedside table. But if you go in and it's not labeled, pitch it and get a new one, because you don't know how long it's been open. Always has time to bear one. Okay. I'm just going to go ahead and open my package. On one side is going to be my sterile gloves. On the other side is my suction catheter. going to pick up my first sterile glove by the cuff, and these are not the prettiest of sterile gloves. Okay, so glove number 1. Pick up the other one so that the cuff covers my hand. Okay, sterile gloves are on. Suction catheter, just double check it. Look at the end of it, make sure there's nothing sharp, or sometimes the plastic is sharp on the end. Okay. You need to pick which hand is going to be sterile. I recommend your dominant hand. So I'm just going to kind of twist that around. Now I'm going to contaminate my other hand. So once I contaminate that, I have to be careful not to touch anything sterile. I'm going to pick up my suction tubing. I'm going to connect them together. Now I'm going to contaminate this part because I have to control the suction. Now, finger over the hole. This is suctioning. Finger off, it's not. Be very deliberate in your CPE that we know, are you suctioning or not. So I'm ready to suction. I'm going to check my catheter. Okay, it's good to go. I'm going to take, and this is where you got to kind of figure this out. You know, practice, it'll help. You move the oxygen mask down.
Very nice.
That's the OB group. They're not very nice to do. All right. Okay. Take the oxygen mask off. Sit it down here so it doesn't go too far. Okay. You have to bullseye this. If you touch this catheter to the outside of this trach, it's contaminated. So kind of keep this part up so it doesn't touch his chin or the gown or anything like that. Keep your fingers fairly close so that you've got, because some of you are going to be like, okay, I'm going to go in, and I'm going to go until either my patient coughs or I meet resistance, whichever comes first. Okay, I'm at resistance. I'm going to pull back just a centimeter or so, and I'm going to start suctioning on and off the suction, circling the catheter to try and clear the airway. So on and off, circling around. You want to be out of there within 10 seconds. I'm out. I'm going to reach down, put the oxygen back up, and rinse. And this is going to be gross. Let's just be honest. It's going to be green. It's going to be thick. It's going to be just be gross. So I'm going to watch my O2 sat monitor. Yeah, you'll notice I don't put my face anywhere close. So once his O2 sats come back up, it's going to be different for every patient. Some might pop right back up. Some it might take a few minutes. So he comes right back up. I'm ready to go again.
When you guys get into actual practice, it's okay if you want to wear like one of the masks with the shields, especially if you have a patient that is alert and you go and you hit that trigger and they start to cough. It's not unlikely for them to cough and some come shooting out that trach. So get down in front of it if you want to without a mask or a face shield on. You're going to get a little bit more than you bargained for.
It'll only happen once.
Yep.
Okay, so I'm going to pull the mask down. I'm going to go in again. This time you should go a little further. You should get a little bit further in because you've suctioned out those initial secretions. So I'm going to start suctioning on and off, making a circle, and it's going to go make a bunch of noise. Okay. Now, this is where you kind of have to make the decision of whether or not you need to suction again. Are the secretions still thick? How far in did you get? Are they still having issues? If not, you stop after 2. If we're unsure about your sterile technique, we'll make you do all 3. Because you can do a max of 3. So I'm going to clean it out again. And I'll show you 3 just that way you guys can see it again. His O2 sat is back up. Take the oxygen off. Go back in. And we'll say this time we go all the way. On and off the button. Suction, suction, suction. This time we don't get much. Now, when you do your last suction, You want to suction all the saline that is in that box through this tubing, because all his respiratory secretions are in here and up through here. You want them to all end up in here, because if you leave them in this tube, they'll solidify. I mean, it's gross, but it will. So I'm just gonna until I see that my tubing is clear. Once I've got clear tubing, I'm gonna wrap this in my hand. There, turn off the suction. And just like you did with all your other gloves, I'm gonna pull my glove over the top of my suction catheter, put it in the other hand, and pull that glove over the top. Now it's totally contained. Done. Just to make sure.
Re-listen.
And then I'm going to turn the oxygen back down. I'm going to clean up my mess. I can take my pulse ox. And I'm all done. It's the sterile technique that'll get you. Okay? All right, so let me show